Good afternoon, dear students of second stream. Topic of today's lecture: oncology. Basic of oncology of malignant and benign tumors. Tumor, from Latin word neoplasm, or new growth, pathological blastoma formation, spontaneously originating in the different organs, differing from bipolymorphism of structure, atypicity, that is difference of tumor from initial tissue by structure, location and interrelation of cells, isolation or autonomy, and progressive limitless growth. Tumor may be benign and malignant. Benign tumors possess expansive growth, resulting in that surrounding tissues move apart, sometimes are compressed and undergo atrophic changes. Clear borders between the tumor and surrounding its tissues in expansive growth imitate the formation of capsule, though it has not true capsules, resembling inner organs. Typical examples of benign tumors: neurofibromatosis or Recklinghausen disease, left illustration, and solid lipoma in upper external quadrant of breast. Next examples of benign tumors: cavernous hemangioma in small child and rectal polyps. Malignant tumors infiltrate and destroy surrounding tissue. Infiltrative or invasive growth is the main criterion discriminating malignant tumors from benign ones. Ability to metastatic spreading is characteristic feature of malignant tumor as well. Typical examples of different kinds of benign tumors, different clinical forms of breast cancer, infiltrating and ulcerative form, rectal cancer and sarcoma of scalp. Annually, 6 million people fall with tumors and 5 million die from them. In the developed countries, among the causes of death, malignant neoplasms take the second place after cardiovascular pathology. In males, the most part from all cases of malignant tumors makes cancer of lung, stomach, prostate, gland, colon and rectum and skin. In females, the most part of all malignant tumors takes cancer of mammary gland, stomach, uterus, large and small intestine. Males fall ill with tumor 2 times as frequently as females. Etiology: Virchow theory of irritation, Kent-Game theory of embryonic germs, Fischer-Wosel's regenerating mutation therapy, Zilber's viral therapy, and immunological theory. At present, tumors are considered to be polyetiologic disease. In the base of their development is a. Chemically carcinogen substances, for example, asbestos, polycyclic aromatic carbohydrates, and others. B. Physical, for example, ionizing radiation, ultraviolet radiation, biological, including certain viruses, and the frequent repeated traumatism of tissues with subsequent regeneration. For the origin of tumor, it's of necessity the presence of internal causes, genetic predisposition and definitive condition of immune and neurohumoral systems. At that, oncogenic effect may be reinforced by non-oncogenic agents and modified by different factors. Practically all chemical oncogenic substances in the organism are undergo different intricate transformations before they gain ability to excite oncogenic effect. Various etiological factors predominate in tumorous etiology with different localization. One of the main causes of skin cancer is ultraviolet radiation. Among the causes of cancer of larynx and cancer of the lung, the most importance is given to inhalation of oncogenic substances, smoking, and chronic bronchitis play an important role. Tumors of body of uterus, mammary gland, prostate, prostatic gland, thyroid glands, hypophysis, adrenals occur during these hormonal shifts in organism. Immunodepressive factors and the usage of powerful immunodepressants with the aim to suppress the reaction of tearing away during transplantation of organs and tissues. The frequency of tumor, for example, skin cancer, cancer of cervix uterine, is 10 up to 100 more than as higher than in same age group of population. Pathogenesis. Rise of cancer is always separated from moment of etiological factor action, so-called latent period, during which clinical signs of tumor are entirely absent. Mechanisms of reorganization of the normal cell into the tumor one have been not yet clear. Pathogenesis. Continue. At that, the cell, as a result of genome modification, gains new heritable features: steady reproduction, incomplete maturing, loss of normal contact with surrounding cells and tissues. Biological and biochemical cell organization is changing. A tumor cell excretes specific antigens, and the organism as a whole begins to take it in as a foreign one, dangerous for the organism. The increase of immune exertion is a result of the process mentioned above. Insufficient mobilization of immune protection, this dangerous cell dies. Tumor don't arise. Such a process in the organism takes place continuously. Occasionally it happened that cancer cell occurs in the place inaccessible for the action of immunity mechanisms, in the focus of chronic inflammation, where the lymphocytes antibodies can't penetrate. In such a case, malignant cell becomes viable and begins to reproduce. The main components predetermining the origin of tumor are local preparedness of tissues, general predisposition in organism to occurrence of malignant tumorous process, and starting mechanism, that is, etiological source impulsing the development of process in defined place in predisposed to tumor individual. Presence of precancerous condition of the organ or tissue is the main of local factors predisposing to malignant tumor. There is no cancer without precancer, but no cancer turns into cancer. Therefore, it's very important for clinician, though not always it's possible, to fix and diagnose precancerous condition. Common factors predisposing to the development of malignant process: genetic predisposition, change of endocrine system function, middle age and old age of patients. By the fact of American researchers, among individuals aged 40 years old, 60 million per 10,000 population die annually. 60 people per 10,000 population die annually from cancer. Among those aged 60 years old, 400 individuals die from cancer, and among those aged 80 years old, 1,400 individuals die from cancer. Influence of benign tumors of the organism. Despite the fact that benign tumors grow relatively slow and don't arise after radical excision, don't metastasis, they may result in severe destructions in organism due to the compression of vitally important organs and structures, as compression of the brain by a benign tumor of the meningeal tunic, compression of large vessels, compression of the bronchus, and so on. Two interrelated forms of systemic action on the organism common for all malignant tumors are distinguished as competition with organism tissues for the vitally significant metabolites and influence on the biological features of different tissues, resulting in disorder of their differentiation and the weakening of the regulating influence from side of the organism. In carbohydrate metabolism. In malignant tumors, glucose isn't produced. On this account, tumor can pump glucose from the blood. Resources of glycogen from liver and muscles are mobilized and spent. The main process that allows to exceed decrease of glucose is glucogenesis. gluconeogenesis. In the cases when glucogenesis hasn't been stimulated or tumor has great size, a pronounced hypoglycemia begins. In amino acid metabolism, tumor tissue is a peculiar thread for nitrogen, as entering by the alimentary path is released in the decay of proteins and nucleonic acids. Introduction of glucose into the organism saves nitrogen, prevents a rise of negative nitrogenous balance, weakens catabolism of tissue, specifically muscular proteins. In fatty metabolism, growth of tumor leads to the intensive mobilization of lipids from fatty depot and muscles. This process is accompanied by hyperlipidemia. Some portion of lipids assimilates by tumor to form membranes of growing tumor cells. Mobilization of lipids is considered as a compensatory reaction of the organism on the hypoglycemic influence of tumor, allowing the tissues to use oxidation of fatty acids in lack of the glucose as traditional source of energy. Nomenclature, structure, and classification of tumors. Histogenetic and histological principles are in the base of nomenclature and classification of tumors. Their cellular and tissue characteristic is reflected in the names of tumors. The names of the most tumors consist of two parts. The first part includes indication of the source of the tumor development, cells, organ, tissue, and the second part is suffix "oma", denoting tumor. It means tumor developing from the fatty tissue is called lipoma, from cartilaginous tissue chondroma, from muscular tissue myoma, and so on. In the name of tumor, besides its histological features, there is indication on its connection with the one or another organs. For example, adenoma of thyroid gland or anatomical area. For example, lipoma of thigh. In the building of some tumors names, we meet deviation from the indicates principles. For example, epithelial tumor of liver is called a hepatoma. Tumor of brain membranes, meningioma. Tumor of the thymus gland, thymoma, etc. Quite often, in name of tumor, its cellular content is stressed. For example, tumor formed by histiocytes, histiocytoma. From Leydig cells, Leydygoma. From Sertoli cells, Sertolioma. Tumors arising from the elements of hematogenic system, lymphoma. Tumor structure may resemble tissues or organs. Then they say about histioid or organoid tumors. In the case of revealing in tumor the elements of embryonal tissue, such tumors are called teratoma. Frequently, the question about malignancy of these tumors is difficult to solve. In this case, the term teratoblastoma is applied. Under the conception of possible structures of development, tumors are subdivided by the main kinds of tissues: epithelial, connective tissue, muscular, vascular, nevus, and mixed. Malignant connective tissue tumors have got the common name sarcoma. This term is applied also for determining malignant tumors of the muscular, vascular, and nerve tissue. The term sarcoma is as a rule added by the indication on its tissue source. For example, chondrosarcoma, liposarcoma. If a tissue source of sarcoma is muscular tissue, depending on its character, smooth or cross-striated, it's spoken about leiomyosarcoma or rhabdomyosarcoma. Technologically, various is indication of tumor originating from epithelium. So, in the names of benign epithelial tumors, not only initial epithelium, but especially peculiarities of tumor tissue and taken into consideration. For example, tumors originating from multilayer pavement or transitional epithelium are called papillomae. Tumors forming glandular-like structures originating from cylindrical epithelium, adenoma or polyps. Malignant tumors developing from epithelium are called cancer or carcinoma. For example, adenocarcinoma, malignant tumor from glandular-like structures. Cancer, from Latin word, malignant tumor development from epithelial tissue. Cancer is possessing autonomous, progressive, irreversible character pathological overgrowth of atypical epithelial cells, replacing and infiltrating normal tissues. However, not all mentioned features of cancer may be considered as absolute ones. So, there are forms of cancer, the growth of which isn't autonomous, but depends on the definite hormones or the other factors of the organism. The notion progressive also doesn't spread on the whole case of cancer. Some kinds and stages of cancer may exist for a long time at the level that has been registered in the primary diagnostic examination without manifesting any signs of local growth and without giving metastasis. Even irreversibility can be considered as an absolute feature of cancer, since occasionally in animals and human beings cancer may spontaneously regress. Microscopic view of tumor is various one. Tumor may have a shape or rounded or oval node and may resemble mushroom or cauliflower. Tumor surface may be smooth or hilly or rough. Relating to the lumen of organ, tumor may be endophytic, tumor is growing through the wall, has in great extent infiltrative, prostrate character, or exophytic, is growing through the lumen of cavity as of the stomach, intestine, pharynx, urinary bladder, and so on. Microscopic view of different exophytic type of cancer, endophyte and exophyte. Different types of growth of gastric cancer, exophyte, endophyte, and mixed. Sometimes tumor infiltrates the whole organ diffuse-like. Microscopically, the border between tumor and normal tissue isn't always distinguishable. In the cases when the border is distinctly distinguishable, they say about presence of tumor capsule. Though tumors don't possess the true capsules. The base for diagnosis of tumor in histological investigation is the presence of structural atypicity of fominid cells. Normal cells and tissues serve as the standard for determining degree of atypicity for comparison. One of the main signs of atypicity tumor tissue is the absence of completeness of cycles of cells and tissues development. Microscopic investigation of tumor displays the degree of their differences from initial tissue, gives the concept of degree of their differentiation. The criterion of their malignance is also ability to metastasize. Usually metastases have the structure of initial tumor, but may considerably differ from it by the degree of differentiation, may be less differentiated. Therefore, recognition of primary focus in morphological investigation of metastasis isn't always possible. Structural atypicity of tumor spreads over all its components, and the main cellular one, parenchyma of tumor and stroma, base of tumor. In view of connective tissue, including interstitial substances, vessels, and even nerve elements. On the assumption of relationships between stroma and parenchyma, conception of encephaloid cancer with prevalence of soft tissue, and sclerosing cancer with sharp prevalence of connective tissue over parenchyma exists. Structure and classification of cancer. The variety of macroscopic kinds of cancer is conditioned by the tumor character, type of its growth, as well as by the peculiarities of the structure of tissues and organs in which this growth takes place. In benign tumors of epithelial nature, structure of character of tumors is usually as follows: expansive, that is with pressing back and compression of surrounding tissue, and exophytic, that is with eminence of epithelial covering or pavement of hollow organs. For the cancer in which tumor complexes or individual tumor cells may infinitely penetrate surrounding tissues, various layers and zones, as of initially affected organ, as of adjacent organs and tissues, invasive or infiltrative growth are of character. Tumor roots itself into lymph and blood vessels, its cells spread over the whole organism, giving origin of the secondary tumor nodes or metastasis. Cancer having endophytic growth spreads mainly in the thickness of the hollow organ wall without projecting into the its lumen. Quite often, these both types of cancer growth, exa and endophytic, are combined, and that tumor has hemispherical or mushroom shape. In some kinds of cancer, due to lack of correspondence between the amount of tumor mass and level of its blood supply, pronounced secondary change as inflammatory necrotic processes develop. This leads to ulceration of tumor, and consequently it gets the shape of so-called saucer-shaped cancer. Quite often, the basis for indication the tumor kind is the presence of the substance or structure produced by its cells, for example, mucous, colloid, cricoid cellular, pseudomucinous cancer, and so on. All of them belong to glandular cancers. Most of occur in stomach or large intestine and differ in a high intra or extracellular production of mucus. This kind of cancer may lose glandular structure, and tumor cells are located in mucous mass. We call situation colloid cancer. In intracellular production of mucus, cancer cells overfull with mucoid substance lie separately in fibrous stroma. We call this situation cricoid cellular structure cancer. Mucous cancer is one of the most malignant forms and apt to early metastatic spreads. Some kinds of cancer have the ability to produce specific structures characteristic for tissues with which they are connected histogenetically. So, in squamous cell carcinoma, coeneous substance in the kind of so-called cancer pearls, produced by epidermis of normal skin frequently forms. At the same time, epithelium of some organs in not forming corneous masses acquires similarity with skin epithelium and benign to produce keratin after the tumor transformation. In this connection, such forms of cancer arising in trachea, bronchi, stomach, and ovaries are called epidermoid cancer. Epidermoid cancer of the stomach is often indicated by the term concroid. Stromal component, besides epithelial component, is the important element of tumor. It's represented by connective tissue, vessels, and nerves. The amount and character of this component also finds its reflection in the names of cancer forms. For example, some forms of adenocarcinomas are characterized by a considerable prevalence of tumor parenchyma over the stroma. The latter gives them very soft consistency and a macroscopic similarity with brain tissue. We call situation as medullary or encephaloid cancer. The other forms of cancer in the lower level of the stromal component of development microscopically preserves similarity with the histogenetic source that has place in hepatocellular cancer. Morphological variant of cancer with developed stromal component in which epithelial tumor elements are represented in the kind of separate cells or small complexes are called scirrhus, from Greek scirrhus, hard or fibrous cancer. On the ground of histological structure, by the extent of deviation from the normal tissue structures, there are distinguished highly, moderately, low differentiated forms of cancer. There are also distinguished non-keratinizing and more differentiated keratinizing cancer. The latter represents histogenetically more mature tumor and contains laminated formations consisting of corneal scales. Its international system of clinical classification of cancer that has got wide prevalence, system TNM, tumor, nodule, and metastasis. This classification provides determination of tumor process spread by three criteria: size of tumor itself, the presence of metastasis into regional lymph nodes, and presence of distant metastasis. Spread of the primary tumor node is indicated by symbol T, tumor. T1, tumor of small sizes, occupying a portion of organ. T2, tumor of great sizes but not exceeding bounds of the organ. T3, tumor exceeding the bounds of the organ and involving into the process adjacent organs and tissue. Sometimes there is distinguished stage T0 or primary tumor is not defined, but there are presented metastases. And stage T in situ to determine cancer in situ, that is intraepithelial cancer. For some locations of cancer, stage T4 is provided. Tumor exceeds the bounds of the organ, causing destruction of the adjacent organs. For mammary gland, tumor degradation is fulfilled by sizes of tumor in centimeter. For cancer of stomach, by the extent of growth through the wall and the spreads on its portion, cardia, body output unit, and so on. Special attention is paid to cancer in situ or cancer in place. At this stage, the tumor is located in epithelium only, doesn't grow through basal membrane, so doesn't grow through blood and the lymph vessels. At this stage, malignant tumor is not yet lacking in infiltrative growth and can't give hematogenic and lymphogenic metastatic spreading. Symbol N, nodulus, is used to designate metastasis into the regional lymph nodes. And X, there is no information about presence or absence of metastasis in the regional lymph nodes. The patient has been observed incompletely, hasn't been operated on. N0, absence of metastasis. N1, presence of metastasis and in lymph nodes collectors of the first order. In some tumor locations, depending on the group of lymph nodes, designation may vary from N1 up to N3. N2, there are metastases in lymph nodes collectors of second order. N3, there are metastases in lymph nodes collectors of the third order. Symbol M, or metastasis, indicates the presence or absence of metastasis in the distant organs and tissues. Index G, or grade, defines the degree of malignancy, degree of cells differentiation, and is introduced into diagnosis only after histological estimation of tumor. Three groups of new formations are distinguished: G1, tumor with low degree of malignancy or high differentiated tumors; G2, tumor with middle degree of malignancy or low differentiated; G3, tumor with high degree of malignancy or not differentiated. Index P, or penetration, is introduced only for tumors of the hollow organs and indicates the degree of growing through their walls. P1, tumor in the limits of the mucous membranes only. P2, tumor's growth into submucous layer. P3, tumor growth through the muscular layer. P4, tumor exceeds the bounds on the organ. Classification by TNM system is considered to be convenient one, since it characterizes in the detail all sites of malignant process. It allows to compare the results obtained by specialists of different countries. At the same time, it doesn't give generalized information about the process severity and the opportunity to cure from tumor. With this purpose, clinical classification of tumors is used. According to clinical classification, 4 stages of tumors are distinguished. Stage 1. The tumor is localized one, takes a restricted portion, doesn't grow through the organ wall, metastases are absent. It means metastasis not only in regional but also into distal lymph nodes. Metastases are absent. Stage 2. Tumor has moderate sizes, doesn't exceed the bounds of the organ, may be presence of individual metastases into regional lymph nodes. Stage 3. Tumor has great sizes with resolution, tumor grows through the whole wall of the organ, or tumor of less sizes with multiple metastases into regional lymph nodes. Stage 4. Growth of tumor through surrounding organs, including those unremovable, aorta, vena cava, and soon, or any tumor with distant metastasis. Stage 0. Cancer in situ also exists. For every location of malignant tumor, correspondence of clinical stages with the stage by TNM system has been worked out. So, for cancer of the large intestine, it looks as follows. Stage 0, tumor in situ, and 0, M0. Stage 1, T1 or 2, nodulus 0, metastasis 0. Stage 2, tumor 3, 4, N0, M0. Stage 3, NET, regional lymph nodes 1, 2 sizes, distant metastasis 0. And stage 4, NET, NEM, M present, or 1. Diagnosis of benign tumors. This is clinical picture and diagnosis of tumors. Diagnosis of benign tumors is based only on the local symptoms, signs of presence of the tumor itself. At that, tumor increase slowly in size, don't hurt, have a rounded shape, smooth, more rarely lobate surface, distinct body with surrounding organs. Mainly, there is prevalence of cosmetic aspect of disease. It means presence of tumor itself. Occasionally, the signs of the organ's functional disorder appear. Polyp of intestine results in obturative intestinal obstruction. Benign tumor of the brain compressing surrounding portions leads to the appearance of neurological symptomatology and so on. Typical view of localized form of mammary gland cancer. You see deviation of affected, elevated of affected breast in comparison with sound side, and the retraction of nipple in visible investigations and in palpation. In clinical picture of malignant tumors, 4 principal syndromes are distinguished. Syndrome of blast tissue, syndrome of pathological excretions, syndrome of the functional disorders, and syndrome of small signs. Plus tissue syndrome, syndrome of pathological excretions, and syndrome of functional disorder, and syndrome of small signs. Syndrome of plus tissue. Tumor may be founded directly in the area of its location as the additional tissue. Plus tissue syndrome. This syndrome is revealed during examination and palpation of superficial tumors in the skin, subcutaneous cellular tissue, muscles, as well as on the extremities. Sometimes they succeed in the definition by palpation of the tumor located in the abdominal cavity. In addition to its syndrome, plus tissue is revealed by means of additional methods of investigations, endoscopic, ultrasound, rentgenography, and others. Syndrome of pathologic discharge. In the presence of malignant tumor due to its growth through blood vessels, a blood-stained discharge and bleeding are often observed. So, cancer of the stomach may cause stomach bleeding, cancer of the lung, blood spitting or hemoptysis, mammary gland cancer, cirrhosis, blood-stained discharge from mamilla, cancer of the rectum, intestinal bleeding, cancer of the kidney, hematuria, cancer of uterus, blood-stained discharge from genital ducts. If inflammation develops around the tumor or mucus-making shape of cancer is revealed, mucus or pyomucus discharge, as in cancer of large intestine, appears. Syndrome of functional disorder. Manifestations of this syndrome are various ones and depend on the tumor location and functions of the organ in which tumor is located. So in tumor of the intestine, especially of the last section of colon, the signs of intestinal obstruction are of character. Dyspeptic disorders, in view of heartburn, nausea, vomiting, are peculiar for cancer of stomach. In patients with cancer of esophagus, the leading symptom is disorder of the act of food swallowing. For example, dysphagia, yes? Disorder of act of food swallowing, and so on. Syndrome of small cell. The patients with malignant tumor formations frequently report not quite explainable complaints or groundless complaints. There are mentioned weakness, fatigability, increase of the body temperature, loss of weight and appetite, aversion of meat food, anemia, increased sedimentate rate of erythrocytes. All mentioned above signs have been described by Russian oncologist Savitsky and are named syndrome of small cells. In some cases, this syndrome appears at the early stages of tumor and may be its only manifestation. Sometimes it appears later on and there is the same evidence of a manifest cancerous intoxication. At that, the patients have a specific oncological appearance, they are thinning, the turgor of tissues is reduced, skin pale with grayish or icteric shade, the hair dull, the eyes sunken. Such an appearance of the patient says about presence in their organisms of neglected oncological processes. The base of tumor diagnosis is their timely identification at the early stage of disease. First principles, early diagnosis, when applying of radical methods of treatment is the most effective. Great importance in the early definition of tumor belongs to oncological vigilance of the doctor. Second principle. It includes knowledge of tumor symptoms, especially early stages, careful examination of patients, even in minimal complaints, collective decision of questions in difficult for diagnostic cases. In treating of malignant tumors, in all doubtful cases, it's usual to make the most threatening diagnosis and undertake more radical methods of treatment. And third principles, hyperdiagnostics. Conclusion: early diagnostics first principle, oncological vigilance of doctors, and hyperdiagnostics. Diagnostics of tumor are subdivided into first, primary diagnostics carried out under condition of a polyclinic or during prophylactic examinations, and clarifying diagnostics, usually carried out in the hospital. During the primary diagnostics, clinical methods, its mean anamnesis and objective examination, allow to suspect tumor and to draw a rational plan of application, instrumental methods of investigation. To define early forms of cancer of lung, fluorography of the organs, chest is used. Cancer of stomach and cancer of colon, fibrogastroscopy and fibrocolonoscopy with Amen biopsy. Cancer of uterus, cervix, cytological investigation. Mammary gland cancer, mammography and puncture biopsy, and so on. Clarifying diagnostics in patients with already revealed malignant tumor or suspicion on it is aimed to estimate individual features of the disease and the patient's state in order to choose most rational method of treatment. At that, it's necessary to reveal local and common criteria of the disease. Local criteria include adjusted location of primary tumor, anatomical peculiarities of tumor growth, histological structure of tumor, degree of differentiation of tumor tissue, and stage of the disease. Common criteria include genetic predisposition of patient to one or another tumor, immunological status of patient, state of metabolism, and hormonal profile. Along with estimation of local and common criteria in hospital, individual features of disease are cleared up and the degree of operation risk are clarified. At that, accompanying disease, functional and indexes and the patient's age are taken into consideration. To reveal individual features of the disease, various diagnostic methods are used. X-ray investigations include uncontrast and contrast methods. This is additional method of investigations. Uncontrast methods, in view of usual X-rayography or rentgenography or tomography, are used to estimate state of organs of the thoracic cavity, extremities, and neck. Contrast method with natural contrast air, more often specific contrasts, are used by the specific indications, more often to diagnose gastrointestinal organs. Widespread have-got methods allowing to obtain detailed, highly exact visualization of slices of the human body organs and tissues at any depth and any level. Computer X-rayography, tomography, and nuclear magnetic resonance investigations, MRI, as well as usual ultrasound investigation. Typical view and stomach cancer and esophagus cancer. Defect of fulfillness. Typical view of metastasis of cancer of liver in ultrasound picture. CT scan view of metastasis in right lobe of liver and 3D visualization with coloration of picture. Endoscopic methods allow to carry out investigation with the help of special instruments, endoscopes, to investigate hollow organs, abdominal and thoracic cavities, intertissue space during which to carry out biopsy or take material for histological investigation. Application of endoscopic methods allow to diagnose early stage of tumor or pre-invasive cancer. Typical view of procedure endoscopy due to tracheo and bronchoscopy, and amnion biopsy with specific breaths and forceps. In any case of tumor or in suspicional tumor morphological methods of diagnosis, in most cases it's biopsy are used. However, biopsy isn't carried out in suspicional to melanoma, since the trauma may accelerate its growth. Biopsy of osteogen sarcomas is carried out only by absolute indications. Radioisotopic methods of investigation are based only on the ability of many tumors and their metastases to accumulate radioactive nuclides. These methods are used to determine location of tumor, its borders, presence of metastasis, estimation of the results of therapy, as well as revealing of functional shifts in organs and systems caused by the tumor and its metastasis. For the diagnostic purpose, radioactive nuclide with a short period of half disintegration is inserted to the patient. Distribution of nuclide is caught in the patient organism by special counters. Laboratory methods of diagnosis of malignant tumors are less informative, since universal laboratory tests for diagnosis of all kinds of tumors are absent. Immunological tests are used. With their help, embryonic antigens typical for some tumors, as for example alpha-fetoprotein in primary cancer of liver and teratoblastoma of the ovaries and testicle, or carcinoembryonal antigen in cancer of intestine, alpha-2H fetoprotein in lymphoma and tumors of brain and some kinds of neuroblastomas, or prostate-specific antigen in cancer of prostate glands, very distributed. In the case of when complex of clarifying diagnostication methods is found to be insufficient, the use of diagnostic operation is indicated. These operations are more often used in suspicional for tumors of the abdominal cavity organs. Treatment of benign tumors. Operative excision of tumor. In individual cases, it's possible to use cryo, laser, or diathermal extraction. Such an approach is grounded by the fact that benign tumors are precancerous conditions, along with ulcers, fistulas, and acid gastritis, mastopathies, uterus cervix erosions, and pigmented birthmarks, and so on. Treatment of malignant tumors is fulfilled by various means depending on character of tumor growth and its histological shape, location of tumor, clinical stage of tumor, patient's age, and presence of accompanying diseases. Treatment of oncological patient may be radical, that cures the patient completely, palliative, prolonging the patient's life, and symptomatic, alleviating only separate symptoms of the disease. The main methods of treating of malignant tumors are surgical treatment, radioactive therapy, medicinal treatment with the use of antineoplastic remedies or chemotherapy. In the process of treating oncological patient, it's possible to combine the main method of treating malignant tumors. If two methods of treating patient are used, they say about combined treatment. If all three methods are of use, it's complex treatment. Surgical treatment is the main one in the most tumors. It may be used either independently or in combination with the other methods of treatment. Surgical operation may be found as a test one in greatly developed tumor process, radical or palliative. Palliative surgery is, for example, applying of bypass anastomosis in the tumors that can't be removed and cover the lumen of gastrointestinal tract. Radical surgical operation on account of malignant tumors is based on the principle of complete removal of tumor within the bounds of healthy tissues. Typical view of surgical treatment of lipoma. Typical surgical treatment of malignant tumor, melanoma. During the removal of malignant new formation, it's necessary to observe so-called oncological principles: ablastics, antiblastics, zoning, and saving case in process of removing tumor. Typical examples of main principles in oncological operation: diagnosis: cancer of rectum, operation: total abdominal perineal proctectomy or extirpation of rectum, intra-abdominal stage. This is example of radical operation. Next examples: cancer of stomach, fourth stage, stenosis of antral part of stomach, operation: applying of gastroenteral anastomosis. Typical example of palliative operation. Ablastics. Principles of ablastics. This is complex of measures directed at the prevention of tumor cells spread at the time of operation. For that, incision is performed only within the bounds of certainly healthy tissue. To avoid mechanical injury of the tumor tissue, aimed to ligate as quickly as possible to vein vessels branching from the formation. During the operation on the hollow organ, it's tying up with the tape above and below the tumor, in order to avoid migration of tumor cells along the lumen. The tumor is removed as a single mass with the cellular tissue and regional lymph nodes. Before manipulation with tumor, wound is limited with the napkins. After the removal of the tumor instruments, gloves are changed. Limited napkins are changed also. Antiblastics. Complex of measures directed at destruction at the time of operation of individual tumor cells, detached from the basic tumor mass, which may later on becomes the source of a tumor or metastasis recurrence. There are distinguished physical and chemical antiplastics. The measures of physical antiplastics include using at the time of operation electric scalpel, laser, cryodestruction, as well as irradiation of tumor before operation and the early postoperative period. Chemical antiplastics includes processing of the wound after removing tumor with 70% spirit, ethylic spirit, intravenous injection of antitumoral chemical preparation. On operation table, regional perfusion of the area of surgical operation with antitumoral chemical preparations. Principles of zoning. During the operation for malignant tumors, it's necessary to remove for new formation only, but the whole of the zone where may be placed individual cancer cells. This is the principles of zoning. These cells may be situated in tissues close to tumor, as well as in branching from it lymph vessels and regional lymph nodes. Principles of zoning in right part of cancer of right part of large bowel. Operation right hemicolectomy. Right hemicolectomy. In exophytic growth of tumor, when its base is relatively narrow and the most portion is directed to the outward or to the lumen, so-called polypoid or mushroom shape of tumor, it's necessary to dissect tissues at the distance 5-6 cm from outer border of tumor. In endophytic growth of tumor, it means spread of tumor along the wall of organ, that is prostrating infiltrative growth of cancer. It's necessary to step aside from the visible borders not less 8-9 cm. Together with the organs or its portion, all lymphatic vessels and nodes gathering lymph from this zone should be removed as a united block. Demonstration of principles of oncologic operation. Radical mastectomy by Holstedt-Meyer, full removing of all lymphoid apparatus within the large and minor portions of the thoracic muscles, and mammary gland cancer in one unit block. Saving case. Lymph vessels and nodes through which is possible the spreading of tumor cells are located in the cellular space, divided by face cell partitions. In this connection, for the most efficiency, it's necessary to remove the cellular tissue of the whole face cell sheet, advisable coupled with the fascia. As an example of observing principle of saving case is operation for cancer of thyroid gland. At that extracapsular removal of thyroid gland with visceral leaf of the fourth fascia is used. In a number of cases, it's justification to perform combined operations when together with affected organ, a partial resection of the adjacent organs is done. Radical operations of cancer of any location may be one or multi-stage. For example, cancer of the colon with great metastasis into the liver isn't removable by means of common resection of liver. Hemicolectomy will be first stage. The second stage, embolization of the branch of portal veins and hepatic arteries, which supply as an affected portion of the hepatic lobe. The third stage is accomplished after 4 weeks when aseptic necrosis of lobe begins and hemihepatectomy is carried out. Demonstration. First stage of this example, first stage of operation in diagnosis cancer of colon descendant, providing left side hemicolectomy with dissection of lymphatic nodules of an first and second order. Second stage, embolization of right branch of vena porta. And third stage, result of right hemihepatectomy carries out in 4th weeks when aseptic necrosis of the right lobe of liver develops. Besides classical surgical treatment, laser or cryodestruction is performed usually. Cryodestruction is used in cancer of skin as well as in neglected cases of cancer of rectum, esophagus, with aim to restore passability and to control the pain to stop bleedings from tumor. The results of surgical treatment depend mainly on the kind and location of tumor and the stage of the disease. The best results having been achieved in treatment of cancer of the skin. In this location, 5 years survival mounts to 90%. At the same time, in cancer of stomach, even after radical operation, 5 years and more live about not more than 30% of patients. Demonstration cryodestruction of metastasis remained in liver. Cryodestruction of metastasis. Radiation therapy. Application of radiation therapy for treatment of oncological patients is based on the fact that rapidly reproducing tumor cells are more sensitive to the action of ionizing radiation. As the result of radiation, damage of DNA and RNA, inactivation of a number of ferments or enzymes, damage of cellular membranes, complicated disorder of metabolic process of tumor cells arise. Consequently, during of the mitosis phases of tumor cells, death begins. Simultaneously with necrotic processes, regeneration of the connective tissue is observed. Subjected to the necrosis tumor, tissue is replaced by a cicatricial one. The efficiency of damage of tumor cells depends on size of absorbed doses of radiation, factor of the time, in the case of interrupted or continuous radiation, the stage of oxygenation of tumor, its reproductive ability, the degree of the cellular anaplasia, the phase of mitotic cycle. The most sensitive to radiation are connective tissue tumors with round cellular structures, lymphosarcomas, myelomas, and some kinds of epithelial tumor, seminoma, tumor and with histological substrate of the integumentary epithelium, cancer of skin, of the lip, cancer of esophagus. Less sensitive are glandular tumors, adenocarcinomas, and highly differentiated sarcomas, fibro and osteosarcomas, as well as melanoblastomas. Existing difference of radiosensitivity of tumor and normal tissue is causes the development after radiation of the most expressive destructive changes in tumor as compared with normal tissues. This difference is called radiotherapeutic interval. For dividing this interval, the methods possessing radiosensitizing action, radiation under conditions of the hyperbaric oxygenation, hyperthermia are used. Preparations of oppressive restoration of the damaged tumor cells are injected. Different kinds of electromagnetic or corpuscular irradiation are used for the radiation therapy, namely X-ray, gamma, or Bremsstrahlung or megavolt radiations, streams of neurons, neutrons, protons, and electrons. Depending on place of being of the radiation source, three main kinds of radiation therapy exists. In the external or distance radiation, devices for X-ray therapy and telegamma therapy is used, including isotopes cobalt-60 and cesium-137. The method is the most effective in superficial tumors. In deep-seated tumors, multi-field or consisting of several fields, cross-impact or rotatory radiation therapy is applied. Intracaval radiation allows to move a source of radiation near the place of tumor locations. The source of radiation through the natural openings is inserted into the urinary bladder, cavity of the uterus, oral cavity, achieving the maximum dose of radiation of the tissue tumor. Intracaval radiation is often combined with distance radiation therapy. Treatment of tumors. Continue. Oblique radiation is indicated in the relatively superficial tumors, for example, skin, lower lip, and eye. It's carried out with the help of applicator, on the surface of which radioactive radon, strontium, cobalt, and other isotopes are placed. Interstitial radiation is carried out by introducing intratumoral tissue radioactive needles, hollow nylon tubes with isotopes of granules aurum-198. In some cases, radiation of tumor may be achieved by means of infiltration of it with colloid solutions containing isotopes or by means of their endolymphatic induce. In some tumors, as in cancer of thyroid gland, their features to accumulate selectively radioactive iodine combinations are used. Depending on purpose of radiation therapy, if it's used independently, is divided into radical, palliative, and symptomatic. Radical radiation therapy makes provision for radiation of zone of the primary tumor and its regional metastasis in medicinal doses. Palliative radiation therapy is aimed to partial destruction of tumor and stabilization of the processes. At that, focal doses are usually lower than in radical treatment. Symptomatic radiation therapy is used at the later stages of tumor processes and is directed on the elimination of individual symptoms dominating in clinical picture of disease, pain, compression syndrome, and so on. The effect achievable in the results of symptomatic radiation therapy has a temporary character. Radiation methods of treatment may be a part of combined or complex treatment of oncological patients. Preoperative radiation therapy is indicated in the presence of tumors which are more often recur and spread metastasis, as in melanoma, sarcoma of soft tissues, cancer of upper jaw, cancer of rectum, cancer of mammary gland, and others. At that, the principal task comes to the lowering of tumor cells' ability for implantation in normal tissues and development of metastasis or local recurrences. Postoperative radiation therapy is directed to the elimination of tumor cells in the operative zone projection in case of insufficient radical surgical operation. Medicinal treatment or chemotherapy means the use of medicinal preparations having a damage effect on the tumor tissue. In the most cases, chemotherapy is one of the components of complex treatment and is used on a certain stage of the disease, supplying abilities of surgical and radiational therapy. However, in some oncological diseases or hemoblastomas, chemotherapy is used as a unique method of treatment. All preparations used for medicinal treatment of tumors are subdivided into two main groups: hormonal preparation and proper antitumoral preparations. Hormones are applied for the treatment of tumors, keeping the ability of the initial tissues to respond to the hormones in non-regulating their growth in so-called hormone-dependent tumors. Cancer of prostate, cancer of mammary gland, cancer of uterus body, cancer of thyroid gland. Antiestrogens are relative to hormones. They block up to receptors of steroid hormones. Corticosteroids are used in the schemes of hemoblastosis treatment too. Proper chemotherapeutic preparations are subdivided into cytostatics, alkylating preparations, and alkaloids. This is both subtype of cytostatics. Antimetabolites, antitumoral antibiotics, platinum preparations, and immunomodulators. Cytostatics inhibit reproduction of tumor cells, oppressing their mitotic activity. At that, alkylating preparations in view of cyclophosphan TOTF, imbihin miolasan attack nucleophilic group and form covalent connections. Alkaloids, vincristine, vinblastine, connecting with microtubes, blockade metaphases of mitosis. Antimetabolites, methotrexate, 5-fluorouracil, mercaptopurine, influence on S phase of mitosis by means replacing normal metabolites and competition with normal metabolites in the chain with certain catalytic and allosteric synthesis of enzymes and with cellular ferments. Antitumoral antibiotics, doxorubicin, bleomycin, rubromycin, suppress DNA and ribonucleic acids synthesis, strengthen activity of cellular cycle regulators. Platinum compounds, cisplatin, oxaliplatin, interact with desoxyribonucleic acid and forming interchain ties, are connected with nuclear and cytoplasmic proteins. Immunomodulators, or interleukin-2, interferon, at the expense of stimulation of immunity in some tumor locations, contributes to the stabilization of oncological processes even in going to far stages of the disease. Taking into account up-to-date abilities of chemotherapy, all tumors may be conditionally subdivided into four main groups. Tumors in which recovery with help of chemotherapy is principally possible. chorionoepithelioma of uterus, acute leukosis of children, lymphogranulomatosis, seminoma of testicle, and Burkitt lymphoma. Tumor in which chemotherapy gives clinical efficiency. Acute leukosis in adults, chronic leukosis, lymphosarcoma, myeloma disease, Jung's tumor, cancer of mammary gland, cancer of ovaries, Wilms tumor, and angiogenic sarcoma. Tumor with low sensitivity to the action of chemotherapy. Cancer of gastrointestinal tract, melanoma, squamous cell cancer or carcinoma of head and neck, retinoblastoma, and cancer of the urinary bladder. Insuloma, leiomyosarcoma, synovial sarcoma, osteogenic sarcoma. And the fourth group, tumor which are practically not sensitive to the up-to-date chemotherapeutic preparations. Cancer of cervix of uterus, fibrosarcoma. Prognosis. Prognosis is determined first of all by the location, stage, and degree of tumor differentiation, as well as by the state of the initial immune patient status. In the external tumor location and timely treatment, prognosis is quite favorable. Location of tumor in internal organs, as well as presence of metastasis in regional lymph nodes, especially distant metastasis in internal organs, greatly worsen prognosis. In sharp suppression of initial immune states, for example, anti-tumoral immunity, prognosis greatly worsens. In low differentiated cancers, prognosis of treatment is worse than in mature forms of new formations. This is all information for you today. Thanks for your attention.